Hi, Jeanette. How are
Hi,
you?
I'm good. How are you?
Good. So nice to see you. There's another traveling RT heading off to some COVID units.
Yep.
Ah,
Uh, that,
neat.
that- that's crazy. I have to say, I've been so proud of our like graduates getting out there and just straight up making a difference all over the country, just helping out wherever they can help out. And I literally couldn't be more proud of the students that we have out there doing stuff. It's super cool.
Yeah, we got some dope people, dope RTs out there for sure.
That's awesome. Yeah, and you're in New Jersey, right?
Yeah, I'm in New Jersey.
Are you in Hoboken?
No, but I visited Hoboken.
Oh, okay. I thought I saw that on there, but man, we gotta
Yeah.
get Rome. You're killing me,
What's going
man.
on?
I've never had a lecture this many people in it.
How many do we have now? I can't see.
Oh, I don't know. I can't it's going so fast. I keep hitting admit. Yeah,
So far, there's 32.
32. Okay. Oh, I see it at the
32.
top now. Thank you. That's nice.
Rome, it's so good to see you.
AC, how in the heck are you?
Good. I miss working with you.
Thanks, you too.
So glad to see you up and healthy and around.
Thank you. Glad to be
You're
here.
welcome. Maggie says hi. She couldn't make it today, but
What
she's
the
thinking
heck?
about you. I know.
Tell her I said hi.
I will.
I feel like it's a big reunion.
Yeah.
It is a big reunion, right?
That's awesome.
Oh, I see Stephanie's on here from St. Anthony.
Uh-oh. I better
Hi,
be
Steph.
on point.
Right.
Oh, hi, Libby.
What's that?
Dustin, thank you for the invite. I really appreciate it.
My pleasure. That's awesome.
Excited.
I gotta tell you, I remember, it's funny because I talked to Rome a couple times before in the past, and then probably one of the biggest times I remember was talking to you about flights and what to do if about getting in on an interview and all that other stuff. And I was thinking, anytime I have anybody who's interested in doing transport, I just think it's awesome because for you all know that I thought it was the coolest job in the world,
Oh, absolutely.
And,
I love it.
until I started teaching. Now I'm getting other people to do what I was doing, but I just think it's so cool, man. And everything, just your family, there's so many people that are associated with you and associated with Pima too. I think it's just so cool. Just a big old family out there. Hey, speaking of, there's Monica. That's awesome.
Hi, Allie.
Yeah, Allie, a former classmate, right?
Yep.
That's awesome.
Yeah.
All right, should we try to think? Well, you want to get started, and we'll talk about I'll just keep inviting. I'll keep admitting everybody in. But Rome, you want to do it? I'm gonna have you do your introduction because no one's gonna do it better than you. So.
You want me to start off, or are we gonna do everybody, or just you want me to go ahead and start?
Yeah, go ahead and give us a when you started in school, and then we'll kind of go from there, your whole journey until getting up into your assignment that you did.
Okay. Yeah. First of all, I want to thank everybody, including Justin, for making this happen. So glad to be here, especially with all my Pima family and Respiratory family. Thank you all for what you guys are doing. I'm excited for all you students, for this new future. And yeah, it's going to be a hell of a ride. So yeah, I graduated from Pima in 2016. Sorry, something popped out my screen. Graduated from 2016 and started off at St. Anthony's, and I've been there since. I was there PRN during my travel assignment, but I back full time. And yeah, I've been also transport respiratory therapist. I do critical care transports, and I've been doing that for almost 2 years here in June. So,
Sorry, I lost my mute button.
no worries.
So we invited some students that are starting March 31st, and I saw a
Okay.
couple of them pop in. What kind of advice would you give them to help to get you to where you are right now?
Yeah, I know I had my ups and downs during school, but it was all worth it. I also worked a full-time job during school. It's not, always about, getting straight A's. I think I was a C student myself, but I got a job right out of high school. I had a high school right out of school, and just network, do well on your clinical rotations, and network was one of the strongest, to put yourself out there.
Hey, Roman, I'm so glad to see you. Sorry I got on late, but just good to see you, buddy. I'm glad to see you upright and doing well.
Hey, thanks, Ryan. I appreciate it.
Absolutely.
Thanks for everything.
So for the new people, Ryan is our campus director, and so he's actually in his office right now, so on campus. And so information that we just got back is yesterday was distributed. We're hopefully going to be getting back staff on campus July 6th, and then students starting coming in August. I can't tell you how exciting that is for us to be able to have you guys there on campus with us again, get to know you guys. And like Roman said, networking is such a big deal for us in the respiratory. Getting to know what hospitals you're going to fit in well at, and when you have a personality like Roman, you can work anywhere. But so one of the things we focus on with our program is kind of getting you comfortable talking to different people in different locations, and getting you to meet different people that sometimes are very similar to your background. I always hate that conversation, Roman. Like, our goal is to have you all have A's and get like the highest score as possible. The most you could probably know. But when it comes down to it, when you look at those things, we're not all A students. I wasn't an A student. Where we take what we do, where we excel. You excel with communicating with people and being friendly with people, and that's a skill, just like getting those straight A's. That'll get you. That's much more likely to get you a job actually in respiratory, is where you're able to communicate well with other people and fit in. The biggest thing I hear from hospitals is cultural fit. Do you have a good cultural fit? So
yeah, I mean, you learn a lot in school and remember it, but you're going to learn mostly out in the field. And I got a job offer on my 4th semester of school, and yeah, I mean, just show yourself once you're out there.
And I will tell you that Roman, he does communicate well. Like me being in campus administration, I don't see all the students, but I got a chance to actually know him while he was a student here. And I'd see him at Firehouse Subs too on occasion because he's working there. And he's just always just a great guy out there communicating. And I think it's a good point to get out of your shell and get to know other students and other programs, other faculty, the administration. I'm excited to have everybody back on campus. I'm hoping it's going to be August or September, somewhere in that ballpark. But it's really a good chance for you guys because you're working in healthcare. I have a background in rad tech is my background. And I would tell you that, that's a big part of everybody's job is communicating. And when you're in the hospital, Roman, do you work with other departments besides just respiratory therapy?
Oh, absolutely. From nursing, radiography, and pretty much everywhere, lab, we're a big role in, the whole healthcare. You're going to work with, everybody.
So, Rome, you want to tell us about your first assignment? Did you do more than one COVID assignment?
I did. So my first assignment, started off in New York. So I was working at St. Anthony's full time. Peak medevac, the transport jobs really slowed down because of COVID. really flying. So, you know, I picked up more at St. Anthony's. But yeah, I mean, oh my God, it was just crazy when, you know, everything first started in, you know, March and April, you know, when it all hit, especially with the first COVID patients. You just never would have, you know, you just never thought you'd see, you know, what this disease can actually do to somebody, you know. But yeah, I took my first travel assignment in New York. A buddy of mine, he's an ICU nurse. He was in Hoboken, New Jersey, and he told me to come out, you know, just get this experience while out here. And, you know, money was good as well. So at first I was kind of sketchy about it. I kind of declined my first offer. And then after a while, my sister Monica, my angel, she kind of pushed me. To, you know, go out there, you know, see what, you know, what kind of other things you see as events, and, you know, you're going to learn a whole different type of, you know, skills out there. So I decided to take it, and I got there the end of May. It was still the, you know, the peak of the pandemic out in New York. Everything was still closed. Took an assignment at New York Presbyterian Well Cornell, a big hospital, almost 2,000 beds, with over almost 50 RTs during day and night. I didn't know what I got myself into. Kind of wanted to go home because I was a little nervous. Yeah, that first day, went to pick up my badge, and I had 1 hour of orientation, mostly with just computer stuff. They had all scripts. And after that, they were like, you're on your own, find your unit and do your thing. It was pretty scary. And, you know, you were seeing, you know, there were so many patients that you had to, you know, see and take care of that you probably saw maybe once, mostly, you know, at most twice in your shift, you know, just because you were intubating, you were coding, you were, you know. Cool thing is they didn't give treatments in New York. RTs didn't give treatments in New York. Nurses did that, so I was cool with that. But yeah, just from Bronx to, you know,
Hi, this is
everything
Trish.
critical.
This is Trish at the St. Anthony's Pulmonary Function Lab in Lakewood. I'm just calling you to remind you of your appointment with us.
That sounds like somebody from St. Anthony's. That's my team. Oh, goodness.
No worries.
I thought she had a question. I just muted her. So-
But yeah, it was honestly pretty scary when I first got there.
And Roman, this is Libby Lance. I'm based in Tucson. I've been with FEMA a few years, and work at the corporate office in human resources. And I have a question for you. Would you do it again, knowing now what you learned, all you learned, and you were hesitant to go? Would you do it again?
I'd say yeah. You know, I did get my vaccine in December and my second in January, and, you know, I have, you know, hope that, you know, this is really, you know, work, and, you know, save lives, you know. I am scared of catching it again after everything I went through. But, you know, it's what I do. It's why I went into it. Yeah.
Good for you.
Thank you.
Very impressive.
Thank you.
Yeah, Rome, I think that's one of the coolest things is you look at the people that are going out there, they're selfless, you know, and they go out and I think that's probably the most important thing. I think you said is it was scary, you know, like it's scary stuff. And yeah, as students, you know, I don't know if I'm sure you remember being a student. I remember being scared to death. My first ABG, the guy was paralyzed. Like he was sedated. He didn't even know I was in the room, and I was scared to death to put that needle into that patient, you know, and doing stuff on that level, going into a COVID unit in a different hospital where you don't even know where the bathrooms are. You don't know where the med room is yet. You know, all those things, and you're just running your tail off. there's so many RTs around the country that are just up and moving and going off to these assignments to help other people out. And yeah, there is financial gain behind it, but there's also fear associated with it, and there's there's consequences with everything. And like we find out that, hey, sometimes you don't have health insurance when you're doing these assignments, and so there's always there's always these other things that are out there that are to be feared and thought through. But we definitely need the world needs people like you that are going to get up and go do those things when everybody else has the fear and they hold back. So
Yeah. I
well,
just, I still, to this day, I remember, working at St. Anthony's, and, I just want to thank all the staff there. Everybody's great. Stephanie. But yeah, I'm just glad, I started off there, especially with the help I got. I just remember, driving home from work one of the days that, I told my sister, I was crying, that, I didn't think I want to do this again. I wanted to probably get a new career, just because, you were seeing, patients, crash, fairly quick, one day, on a Thursday they're admitted, Saturday they're intubated, prone, maxed out on pressors, and, just real sick,
that's tough. We've had a couple of students that have come back, and that's the thing that they said is, I'm glad I did it, but I'm never doing it again. And it's tough. I think it's really, especially for the younger group that hasn't worked on the floors. Like the people that have just recently graduated, and they're going out and they're getting in the ICU right away. And and COVID's it's tapering down, but like we had students that graduated last January, and they got thrown into the ICUs right away. They never had that ability to see the floor care where you're making it, you're doing treatments and you're making a difference, and you watch, like you have 100 people come in and 99 of them go home, and then you get into the ICUs in COVID where you have 100 people come in and maybe 50 of them go home. That's a big difference, and it hurts in a different way,
right.
And that hurt sticks around for a long time. What was your favorite thing about your assignment?
My favorite was meeting new people, and just, learning, new ventilators, like the servo eyes are used I never worked with, learning that, yeah, I mean, just learning new equipment, new tools out there.
Did you get to meet some good RTs that were helping you out along the way?
Yeah, there were a lot.
That's
A
good.
lot good, a lot bad, a lot, but I'm didn't judge anybody. I did my thing. I saw a lot of mistakes out in New York, which, I guess is, you're gonna see it just because, everybody, you're running back and forth. You're not getting a lunch, during that 12-hour shift. But a lot of, a lot of great RTs. Yeah.
So how was Texas? And whereabouts in Texas were you?
So I was staying with my sister. She was out in Fort Worth, but I was actually working about 40 miles away in Mesquite, Texas. It's a small town. The hospital was a 70-bed hospital, so it was a lot smaller compared to where I was at in New York, 2,000-bed. I liked it a lot more, but honestly, I think it was maybe busier than New York. But yeah, I was there for almost 2 months until the day I got sick.
Did you know right away that you were sick, or were you have a little unsureness on it? Like, I think I might be getting sick, or?
Yeah, I wasn't, I just never thought, I'd, catch it, but it's Texas. And, there was a lot of people that weren't wearing masks there. But yeah, the first symptom was coughing blood. I was coughing a lot of blood out. But I really honestly didn't think it'd be COVID, just because I hadn't really heard of anybody coughing out blood. But it was that pneumonia hitting.
Hey, Roman, when did you know that you were sort of in trouble health-wise, like your own personal health? When did it become like, oh my gosh, this is serious?
It was one of the days, actually, the next day after, coughing out blood, I was going to go to work, and I had stopped at Taco Bell and to grab some before work, and I was eating my food and I couldn't taste anything or smell. And I was like, okay, this is COVID. So I called off of work and I went and got tested. By then, you're getting a result within 7 to 10 days. So I didn't know right away, but I just went home and kind of relaxed, see if I'd get better for the next day of work. And I just got worse, fevers, body aches, just didn't feel well at all.
So I just want to open it up. If any, for people who have questions, there's a question in the chat. Can we ask questions? Absolutely. Feel free to ask as many questions as you want.
Yeah.
Sadiq,
Okay. Yeah. Hey, my name is Sadiq. I'm in semester 3. Just finished my first rotation of clinicals not too long ago. I got quite a few questions, so I'll ask, throughout the whole meeting. But the first thing I wanted to ask you, so did you learn anything like fundamentally different that different states practice from from Colorado or from New York to Texas? Like, are there any fundamental differences, or do we expect to see the same kind of like stuff? You know what I'm saying? Like, do you know that?
Pretty much everything's the same. We could do a lot more here in Colorado than New York. For instance, the hospital, it just depends on the hospital you're at. Like the hospital in New York, RTs, didn't give nebs, they didn't drop gases just because they all had their first, second year residents. But yeah, it just varies from, state to state, hospital to hospital, but other than that, especially in the ICU, what we focus on mostly, running the ventilator. Like here at St. Anthony's, we could do a lot with the vent. And then, we have to get, orders by the doctor, okay by the doctors. And then in New York, all we could touch is pretty much FiO2 and PEEP, and, everything else you have to, get an okay with the doctor. And it has to be like an attending, can't be like a resident. It's just, weird.
Interesting. When you had COVID or post-COVID, are you experiencing anything still, or do you see evidence of like reshaping? Are you feeling things? Do you feel a change in yourself, or do you feel like recover?
Yeah. So, yeah. I still feel short of breath to this day. My oxygen levels run anywhere from mid-80s to 90s with exertion, and I have to wear oxygen at least 2 liters with exercise or when I go to physical therapy. But yeah, the shortness of breath is still there. I did develop a peripheral neuropathy in my feet, nerve damage, areas of my feet from, it's just hard to say, either from being bedbound for so long, where I was prone and my face were down on the bed, and just hard to say what caused it. You see that a lot of people with diabetes, but I'm not pre-diabetic. I've never been diagnosed with diabetes, but yeah, that's the most thing that bothers me the most. That pain in my feet. Sometimes there's days where I couldn't walk. But it's improved.
do you remember going on bipap or heated high flow? And do you remember like the conversation before intubation and stuff like that?
Oh yeah, absolutely. So I was admitted. the end, between the last week of September. I don't remember the exact day. But, when I went in, I was on room air. Within a few hours, I was on 4 liters. At that time, the hospital was so busy, they didn't have any beds available. So I was in the ER for a couple days. But just slowly, I was getting real hypoxic. My oxygen levels were dropping. I went from 2 to 4 to 6, and then the high flow to 10 liters. And then that's when I finally got a room. And I just, being an RT working, in the ICU, and just, we know what's going to happen next, But yeah, after that, I told the nurse, I was like, they all knew I was an RT. I was like, can you call respiratory? And, I want to be on the high flow, and some positive pressure to help with my ventilation. But yeah, I was maxed out when I was on 60 liters, 100%. From there, they grabbed a gas, I was ventilating well, the oxygenation, was dropping. It was, I was in ARDS, my PO2 was less than 100 on 100% oxygen, But yeah, and then from there, I was on max settings on that heated high flow, and they asked if I was ready for BiPAP, and I said yeah, and I was on 22 over 16 for a couple of days until they moved me to the ICU. But yeah, it was rough. I remember, they were trying to give me nutrition, they were giving me Ensure, just taking off that mask, I was fighting for every breath. It was so hard to, it was just overall, it was just hard to do anything, barely moving, my sats would drop. I'd, exacerbate myself. Yeah, there was one time where sister sent me I'm Christian myself, and we, she sent me a worship song, and I heard it, made me cry. It made me real short of breath. But yeah, they had me on Presidex, morphine. It was hard to communicate, throughout, being on BiPAP. So the nurses most of the time will, give me their number, and I text them through my cell phone. And I still have these messages to this day where I'll be adding to my book, where, I'm texting the nurse, can you go up on the Presidex? Can you go up? They were okay with me, telling me if I need to go up or down, just because they knew, my background. But yeah, it was real scary. And then, that day when, I was on so much pressure for so long, I developed, a pneumothorax. And, I remember everything, was in so much distress, it's like you running at full force and not able to catch your breath, it's just a horrible experience I'd never want anybody to go through. But yeah, I can remember taking off that mask when I told the nurses, I was like, they were trying to give me more morphine, they didn't want to intubate me because, once you get intubated, there's a chance you'll never get off the ventilator, But how many days were you on? I believe it was maybe 3 to 4 days. But yeah, they started off, the pressure's low, and they just continually going high just because I was desatting so much. But yeah, I still remember that day when, told the nurses to call the doctor, and, that I was done with it. I was done with this, I was fighting, it's fighting hard. That I was already intubated. I just remember popping off that BiPAP mask, and I told the doctor, excuse my language, just fucking intubate me already.
I guess that's when you know.
Yeah.
Right?
Yeah.
He didn't argue with you, did he? So,
Nope. Yeah, I was like, it's time, Yeah, it was real scary. And I'll share a photograph with you when I was intubated for a lot of you that you have, haven't seen. I don't know if you could see. Are you able to see?
I have a question. So did you, I guess you weren't were you on the ventilator long enough to have to go to trach, or did they keep you, or you did
Yep.
get trach?
Yep, I did. Still got my.
Okay. Okay.
Yeah.
So they were proning you and filling you and all that stuff.
Mhm. Yeah. Yeah. So, yeah, I was proned. I don't remember for how long, but they definitely did prone me in Texas. Yeah, I went into went into renal failure. Developed pneumos. Um, I'm a pretty heavy guy, and it was hard for them, to get the right dosage of. They gave me propofol. It's an anesthetic drug, to deeply sedate somebody, and it really affects your, heart rate and blood pressure. So they gave me too much of it. My heart rate dropped. I was pretty bradycardic. My heart rate was almost in the 30s, and flatline. I went into cardiac arrest, and they did 3 rounds of CPR, and they fully resuscitated me. Went into renal failure. Just everything bad you could think of.
So do you feel like your experience has like changed your perspective on like your patient situations and kind of had you like make you think differently when you're caring for them? Has it changed, or do you feel like you're still giving the same kind of care?
Well, absolutely. I'm excited. I'm going to be returning to work here and actually next Friday might be my first day returning to work. And, I'm excited, a little scared and nervous, but, I know I have, all my colleagues, looking out for me and, having my back if I need anything. But, definitely, my perspective is going to be, a lot different, from, just knowing what, they're going through, yeah.
So how long were you trached for?
So I was transferred from Texas, the Texas hospital, October 13th. So actually the company I work for, Peak Medevac International, they're the ones that donated a plane, and I'm sure a lot of you guys know Heidi. She's also a transport therapist, and one of my good friends, Kate. They actually went and picked me up and transferred me out here to St. Anthony's. I had no idea this was going to happen. I still remember, waking up in that COVID unit and be like, where in the hell am I? And, I remember seeing a nurse that I knew, and I was like, okay, I'm home. But yeah, I was trached, a couple days after being admitted, I believe maybe the 15th or 16th. And I wasn't trached for too long. They downsized pretty quick. Within a week, I believe. I had an 8 in, I went to a 6. But they had to put another trach in. It was a Bavona, an extra long trach. I'm a big dude, so I have that, weird anatomy. But yeah, I was decannulated within a week after. It was scary, but at the same time, you were super sick and you were on so much medication that, what can you do?
Did they let you suction yourself since you had to do it?
They asked, but it's kind of hard doing it, yourself, and especially, being bedbound for so long. My movement, I was real shaky. I was real weak. I couldn't barely move my hands, so I just, everybody, all my,
So how does that feel as an RT, knowing now how suctioning feels, being that you suction so many people while awake, giving trach care? Like, how does it actually feel? Because I've always had that question, like, is it painful? Like, what are you actually experiencing,
Hey, Roman.
Yeah.
Can I share a little bit from what I know when you were a patient here?
Absolutely. Yeah.
So I work with Roman at St. Anthony's, we love him to death. When he was intubated and trached, he actually asked us to suction him and bronch him constantly, frequently. The staff would come down and say, you know, those quad patients that are difficult and request everything, that's Roman. So Roman was very engaged and involved in his care. And I would say, I would guess that suctioning is very uncomfortable, but that was something that he wanted constantly. And he wanted us to bronch him too. So whenever we did that, it must have made him feel better. And I think he just wanted to improve and get off the vent. And he was going to do whatever he could to play a role in his care. But it was funny. Staff were like, he's that patient that you don't want to go back to see anymore. But we loved you, Roman. We wanted to still be there.
Thanks
for it. And I don't know if you remember.
Thank you guys for everything. I do remember a lot of that. But yeah, I mean, suction, it felt weird. I mean, it didn't hurt. It just felt, you know, a little, you're hitting that, you know, that nerve, but, you know, it didn't hurt at all. It just felt a little odd. But I was also, you know, drowned in my secretions. I had so much, you know, that's why, you know, and it was real thick, you know, bloody, you know, it was just real uncomfortable. Once they suctioned, I felt better, but 10 minutes later, I needed it again. My cough wasn't, you know, too strong enough for me to get it out on my own. So I remember, you know, I'm sure I went through those 14 French catheters a lot. And yeah, I had so much, you know, I know a lot of the critical care doctors there, and I just remember them, you know, if I can be bronched, a lot of them didn't want to, but one of them, Dr. Bolton, said, do what you want, you know, but yeah. And I really like trach care. It felt good on my stoma, especially the cool mist and stuff.
So Rome, what was the thing that you felt most comfort in while you're intubated, and what made you feel the most comfortable?
The most comfortable?
Yeah.
During my intubation.
The whole time, was it like that staff interactions? Was it like a certain medication? Was you know, like
yeah, I mean, you know, especially being, you know, I thought it'd be kind of weird, you know, being, you know, at the hospital you work at, just because I know so many people, you know, they're like family. So, you know, it didn't bother me too much, especially in that state where, you know, you're real sick and you're not feeling well, you know, you're on tons of medication, you're like, whatever. But I felt real comfortable having, you know, my family around. Yeah, that was the best part, you know, it made me feel good.
Hey, Roman, first of all, thank you for doing this. When did you feel like you were on the mend, or when did you have like that first idea that you were recovering and getting better?
I'd have to say, you know, once, you know, because I was on dialysis because I went into, you know, renal failure. My labs were horrible. I was getting dialysis, I believe, maybe 2 or 3 times a week. But after dosing, you know, my labs were, you know, going back to normal. I started to pee. That was a good thing. But
sure.
Yeah, once I, you know, I saw that, you know, it made me feel a lot better. You know, I thought, you know, oh, you know, I'm gonna recover from this. You know, I'm starting to feel better. You know, this is what I want to see. You know, I thought I was gonna get worse. You know, I was scared of, you know, I was hearing, you know, people getting PEs, you know, getting clots, I'm sorry, and, you know, having heart attacks or strokes, or, you know, but, you know, I was getting better. You know, actually I did have multiple PEs as well while I was in Texas, and I'm still taking blood thinners for that one, Aliquis, that I take twice a day. But yeah, once, you know, I saw my kidney function get better, that's when I noticed, you know, I'm getting better. You know, I'm gonna fight. You know.
How cool is it that it was another Pima grad that transported you back to Denver?
Oh, it was awesome. You know, I'm glad it was them. You know, Actually, Flight for Life, I believe they were going to pick me up as well. And, you know, if it was them, you know, I'd be happy. And a lot of them, you know, they're all great, hard, you know, dedicated workers. But, you know, I'm glad, you know, Medevac picked me up. It was awesome.
So I have a quick question for you, Rome. Working with you, just for background for everybody, you know, we'd always bounce ideas off of each other. Hey, what do you think about this? What do you think about this medication? That's typically outside of respiratory therapist practice, our scope. Do you think your knowledge that you always would go above and beyond and know what the medications were, what treatments were on nursing side, do you think that helped your outcome and beating COVID and being so strong?
Oh, absolutely. Yeah. You know, a lot of these drugs that I was on, you know, I already knew about. But yeah, everything from, you know, the remdesivir, all the sedation medication, just, you know, I was glad, you know, I knew what they were putting in my body and what it was going to do to me, but, you know.
Stacy, did you ask that question because of advanced pharmacology class that you're teaching?
Well, not just advanced pharm, but as when I was at St. Anthony's and I took students and seeing other RTs out there and hearing student conversations from all paths of my career saying, oh, well, you won't need to remember this when we're out in the field because we're just going to work on the ventilator. And I just want to get the point across. It's so important that we understand what our other teammates are doing with us too, and understanding their scope of practice so we can give overall total care to our patients.
Absolutely. I mean, usually the first thing I do when I get a report is I see what kind of, you know, medication they're on, if they're paralyzed, sedated, are we able to wean them the next day? Because I do nights. You know, it's not all about the ventilator, not all about, you know, respiratory, you know, it's everything overall, the whole body, you know. But yeah, I mean, it's pretty much one of the first things I looked at, you know, during report and communicated with the nurse. And, you know, are there ways where we can, you know, decrease this Precedex or, you know, get them off the paralytic and, you know, try to get them off that ventilator.
So Gina had a question too, is what gave you the strength to keep fighting?
Everything, you know, my family, seeing my sister almost every day, you know, it's, I don't want to go, you know, I'm young, I'm 27, you know, I have a lot, you know, to live for, you know, yeah. But yeah, you know, I'm very religious, you know, you just keep fighting, you know.
That's awesome. I think it's kind of one of the weird things for us as practitioners is like we start looking at our own mortality, you know, and like that's one of the things that I think it pauses us the most. In, you know, when I think students, first time you walk into a COVID room the first time and, you know, you have your respirator on and there's a caution that you have, like, am I sure I want to do this? You know, like, am I covered? Am I going to be okay? And it gives you that whole, like, I am not invincible anymore. And what happens afterwards? What happens if I'm sick? Who do I trust? Who do I lean on? And it's cool, I think, too, in a way, you get to see who stands up and who doesn't, right? And who adds value to your life and who doesn't. And those are really cool things that you know, if you take the blessing with the curse, you know, that's the blessing, right? You get to see your sister. I mean, I talked to her so many times, and like you just tell she's 100% invested, and that's awesome.
Right. Yeah. Yeah. She's like my mom, you know, she's more than a mom than my sister. And my mom passed away when I was real young, but yeah.
That's cool.
Yeah.
It's awesome to have people like that in your life, you know. And,
yeah, absolutely.
Obviously, your teammates, you know, Stacy always talks so highly of you, and yeah, I mean, every interaction I've had with you has been positive. You know, so I think that's awesome, man.
Thank you, appreciate it.
Does anybody else have any questions?
I think there's a question from Dominic Pitts.
Yeah, hi Rome, I'm Dom.
Howdy.
I'm a student at Pima as well. I'm in my 3rd semester, and I gotta look at what I typed. Yeah, so when you were talking about some of the symptoms you had once you recovered, have you felt like you had some of these other long hauler symptoms that I keep hearing in the news about how some people are like real tired? It's hard to like find motivation to just keep going and doing things. They're like,
Oh, absolutely. You
yeah.
know, there's a little bit of PTSD, you know, from everything that happened. But yeah, you know, just a shortness of breath, you know, just, I'm not, you know, the fatigue is there, but I try to fight it. You know, I try to get out as much as I can. Just try not to be in home, be in the house, you know, just because just makes you feel, you know, just reminds me of being in that, you know, ICU room. But yeah, I mean, it's all there, you know, it's scary.
Did your taste and smell come back, Roman?
I did. Yep. I'm real glad because I love food. Yeah, but yeah, I mean, I don't remember when it actually came back, but it did. I guess maybe the day I ate that nasty hospital food. Yeah.
I love that you can still have a sense of humor about it all too. You know you know, and I don't know if other people have it, but that transport twisted sense of humor thing helps out a lot. I know Heidi has it. So.
Oh yeah. Yeah. You know, being in the respiratory field, you have to have it. You know.
Yeah.
Yeah.
We have a different level of coping that that keeps it fun though.
Yeah.
Any other questions? No. Were you doing calculations in your head that Derek may have given you?
Maybe a couple, but not too much.
That's why everybody's facial expression was the same. That was awesome. It was all in unison. I'm gonna play that back on the recording and watch that. Yeah, that's awesome, man. You know, I think it's gonna be really hard to, in a way, a blessing that you know what's going on, but then a curse that you know what's going on.
Thank you, Allie.
Yeah. I just wanted to say, Roman, our class, the Beta 2s forever, definitely we're on your side and praying for you every single day. So seeing your updates and stuff were awesome to see how much you were fighting and how strong you were, and to see you how well you're doing today definitely makes us all happy. And yeah, super
Thanks so
happy
much.
you're doing great.
Thank you. Miss you all. It's gonna be 5 years here in July.
I know, it's crazy.
Yeah.
Hey, Monica, I see you on there. I just saw your picture pop up. How are you? Oh, the sound's terrible. What's it? Are you able to hear us okay? Oh, I think our microphone's broken. Hey, oh.
Can you hear me now?
Yeah.
Oh, I just wanted to say that, yes, Roman was doing Derek's calculations. He was always telling the RTs what settings to put his ventilator at all the time.
Actual over desired, right?
Yes.
That's awesome. That's cool. Well,
Just wanted to say that I was trying to get in and jump in, and I just wasn't seeing a response. So that's all I wanted to say.
Monica, it was so nice talking to you and keeping up with everything that was going on. I really appreciate you being able to share stuff so we can share it with other people. And I know that like being able to utilize our social media platform helped out with the GoFundMe. As soon as people started seeing that, I could see it just sharing and sharing and sharing.
Absolutely.
So I think that was, I don't know. I just think you're wonderful. So
thank you.
I just wish you could have stayed with us.
Well, I may be back. You never know.
Hey, sold. You're welcome anytime. So.
Thank you. All right. Thank you so much, everybody.
All right. Thank you. Any other questions for Roman at all?
I think I did see one. Let's see.
Oh yeah.
Yes, hey Roman, if I had any past medical history, I do. I do have high blood pressure, that's pretty well controlled. Was well controlled before COVID, but that had a factor to do with it. And, I'm also, morbidly obese, I'm a big dude. So I had a, mostly, that would affect it the most was my, my weight. I am working on it. Thanks to my sister, she's, she cooks well. She's helped me get through this diet that I'm on, but yeah, I'm hoping to drop some pounds and, feel good,
Hey, Roman, I just want to say you're always welcome to stop by the campus at any time. We'd love to see you, especially when we come back in July. Stop by, please.
Oh, absolutely. I'd love to. Thank you, Ryan.
Yep.
Thank you.
And for those of you, now that I have you trapped and you can't go anywhere, don't forget about our American Lung Association stair climb that we're doing. There's a Colorado State Respiratory Care team that we're doing. And I would love if we could do it in honor of Rome. That would be awesome.
When is it?
Oh, you gonna call me out right now on that? I don't.
Yeah.
I'll post it again. I think it's April something.
Oh, I won't be there.
Talk about something else for a second. I'll tell you.
Yeah. So you're going back to work on, what did you say, Friday or next Friday?
Yeah, next Friday.
And so you're going to be going back. You went through this crazy experience. And so do you have any fears going forward that, like, maybe exposed to people who, because you may be compromised, you get sicker quicker? Like, how are you done with that?
I am pretty scared, especially, after everything I went through, being in the hospital for almost 80 days. It was, like I said, something I don't want anybody to experience. But yeah, the fear is there, but, this is what I love to do. I love to help people. My mom passed from breast cancer, and this was, made me get into the field. And, this is what I want to do. I did get my vaccine, and I'm hopeful for it. It's, I think that's what's going to protect me. So get your vaccine.
I remember next Monday. Are you guys able to hear me?
Yes.
Next Monday at Dick's Sporting Goods, there's having a huge, Centura is doing a huge vaccination. So remember, as students, you're following that 1B, so you are able to get vaccinated. So go ahead and sign up. Sign up soon so you can get a spot and you can get your vaccination. You may need that before you're able to go to clinical rotations. They may require us to have that to get into different facilities. And they don't need to give us a heads up. They can say the day before, hey, well, if you don't have a vaccination, you can't come. And that'll be the rule. So make sure you're being proactive on that.
Hey, Roman, I have a question for you. I know that they were talking about people getting severe reactions to the vaccine if they had tested positive for COVID. Did you have any of that?
Nope, no reactions. First dose, had the sore arm, a little fatigue. And then the second one, I did feel a little more sick, ran a fever. I went away within 24 hours. Again, arm pain, sleepy, tired. But other than that, no reaction to it. And then within, 72 hours, I was fully, back to normal.
Dad, I had the same thing after getting COVID, and I had the vaccination. The first one, I was like a little tired, and then the second one, I was tired for about 24 hours.
Mm-hmm. Yeah. Get your vaccine.
Geez, I think I had a worse reaction than you guys did.
Well, you're pretty wimpy.
Jeanette, me too. I didn't feel nothing that first shot, but that second shot, I was down for about 4 days. So
yeah,
I also didn't get COVID, so I don't know.
I have
All
a
right.
question for Stephanie real quick. How did the staff react when they found out Roman was real sick?
It actually still makes me emotional.
Me too.
Very emotional for all of us. We love Roman very much.
Thank you. Thank you.
I kept in contact with his sister Monica pretty much on a daily basis, trying to get him back home. The staff very much had, I would say, conflicting feelings about bringing Roman back home. They felt that they would provide the best care for him and wanted to provide the best care for him, but at the same time, with the situation that he was in Texas with requiring resuscitation, that was scary for our staff to have to do that to him. Sorry.
No, you're good. It's making me tear up thinking about it too.
I'm not as strong as you are, but yeah, staff were scared. They wanted to provide the best care, but at the same time, they didn't want a outcome that wasn't what we all wanted. So,
Right.
but he came back home, and staff, we love him and adore him. And if you guys have seen anything on social media, Roman is loved by every discipline. He touches every discipline: nursing, facilities, housekeeping. People just adore him, and I think he's always done a great job taking care of his patients. He has always put his patients first, and I don't think that this experience will really change the way he cares for his patients, because he's always been a great care provider. But
Absolutely.
Thank you,
we're
Stephanie.
excited to have him back
We
next
all
week.
love you, Roman.
Thank you.
Yeah.
Thank you. Appreciate it. Anybody else have any other questions?
No, but I do kind of want to add to it, to what Stephanie was just saying there. I worked full time at St. Joe's before I came traveling, and one of our staff therapists also got COVID, but we didn't know about it until unfortunately she passed. So I'm gonna cry. Sorry.
Yeah, I do remember Marcia.
I can only imagine the relief that the therapist at St. Anthony's felt when you started getting better. So I know I only met you that one time in state conference a couple years ago. I don't know if you remember, but I remembered you, and I heard about everything that happened, and I'm just so glad that you're doing okay.
Thank you. Appreciate it. Thank you.
Oh, and can I just say how much I miss state conferences, and we need to get those back as soon as we can, because they're such great networking, and you really get to meet amazing people, and even some of us get to really embarrass ourselves at conferences.
Tremendously.
Yeah. Oh boy. All right. Well,
It's a time to learn and have fun.
yeah, it's such a great opportunity, and you get a lot of laughs, a lot of good interactions, and you get to meet people you'd never get to meet any other time. To see managers and directors and practitioners from other hospitals. We're getting our little silo in our hospital, and we work away and we do our stuff, and it's not until we actually get out to those events that we get to see different dynamics, different learning experience, the way different procedures and policies, and it's pretty cool. Different senses of humor as well. So, or dancing styles, different dancing styles.
Yeah. Good times.
All right. Any other questions?
Hey, Roman. My name is Gian. I start school at the end of the month. First and foremost, I want to say thank you for sharing your story. It's awesome, man. You're amazing. You're a warrior. Any question about school? Like, is there certain subjects that you had a problem with that like you wish you could have done a little better? Is there anything you could have done?
Throughout my, my high school career, I didn't do well. So I had trouble with math and science, and I did fail, math and science in my first semester. But I was also, working, more than full time, about 50 hours a week. And I did have, I had to stop working so much and, to focus on my career. But, mostly it was math and science I had to retake, but, just, push hard. You know, you don't have to pass your class, you know, with an A. There's a lot of people, you know, that stress about, you know, having an A, but, you know, it doesn't always matter about having an A. That's not what they look for, you know, during an interview, or, you know, it's, you know.
Thank you.
Mhm.
Yeah, that first semester is always that's the tough one. It's getting
It is.
It's getting your learning style down. It's getting your studying habits down. It's getting all that stuff. And you know, I think it really, Rome, it's very personal to share some of those things. And I think but as we get older and we get more mature in the career field, it's important to share those things so other people can walk in our path and know that it's you know, like, we have hiccups and sometimes we don't do exactly what we thought we were going to be able to do in a certain situation, but you can always adjust, you know, I would say adapt, adjust, and overcome. Right.
Right.
And you did that, and, you know, look where you are and look how you love now. And I think that's a perfect example of when you're struggling in first semester, it's just not giving up. Right. It's
Right.
you know, and knowing it's okay to fail sometimes. It's okay to do embarrassing things. It's okay to, you know, to make mistakes. It's just, how do you fix it? How are you going to stand up and fix and acknowledge your mistake and move forward? And once you figure that out, you know, everything else is gravy after that, right?
Right.
When you become you become humble in your mistakes.
Oh,
If you
absolutely.
can do that, you lose that ego and you're humble in your mistakes, you can do anything.
Yeah.
I think that's cool.
I didn't know what I was getting myself into. I thought I was going to be, you know, easy, but it was tough. It was real tough, especially working a full-time job, you know. But, you know, I did it. You know, I'm here now. You know, I'm doing the job I love. You know, working with great colleagues. You know, doing the transport. You know, having fun. You know.
That's cool. Well, I hate to speak for everybody, but we love you, man.
Thank you. Thank you. Appreciate it.
Any way they can get in touch with if you have any extra questions?
Yeah, absolutely. You can reach me through Instagram or Facebook or my email. I could send it to you all, or if I could give it to you, Justin, and you can send it out to the students.
Okay.
But yeah, you could type in, you know, my name on social media, Roman Vias, and you'll find me. You can ask, you know, any question you'd like.
You're gonna have like that huge Instagram pop, man. You know,
that'd be cool, but
yeah. All right. Well, we're right at
Hey,
that.
Roman.
Oh, go ahead.
Hi, I just want to say I'm a new student. I start next week, and I just want to appreciate you sharing your story. And I think you're killing it. So it was really nice, you know, hearing your perspective. It definitely opened my eyes a little bit.
Thank you so much. Congratulations. You're gonna love it. You know, just enjoy it. You know, I miss respiratory school a lot. But yeah, you know, enjoy the ride. It's gonna be fun.
Yeah, I'm looking forward to it. Thank you so much.
Thank you.
You want to tell them how cool their instructors are?
Yeah. You know, actually, you know, I know Derek is still there. Hi, Derek. I don't know. I think, were you there when I was there, Justin?
No, I started in 18.
Yeah, I think it was just Derek.
Yeah, and then Nicole started probably right after you left.
Yeah, but you know, everybody was awesome. You know, I learned a lot. You know, it was, you know, I'm glad I went to Pima. You know,
that's awesome. All right. Well, yeah, if any of you guys have any questions, hit them up on Instagram or Facebook. And Rome, thank you so much. I really appreciate you. This has been one of the best turnouts we've had for a lecture.
Thank you.
All right. And hey, always feel free to contact us and chat. We love you, man.
Yeah, bye, Roman. Yeah,
Just want to thank everybody.
Campus
I want to
someday.
thank everybody again. You know.
Thank you.
Go next.
I'm also coming out with a book, so follow my page. It's going to be called "Say I Won't Breathe," so that'll be out by the end of the summer. So, yeah, thank you all. Thank you all for what you do. You know, it's going to be great.
All right, Roman, you make sure you send that to us. We'll post it on our Facebook page and boost it.
All right. Thanks, Justin. I appreciate
All
it.
right, all right, man. You
Thank
take
all.
care.
All right. You
Bye,
too.
Roman.
Bye,
Go
everybody.
Nugs.
Bye,
Bye.
Roman.
Go Nuggets.
See ya.
Anybody else have questions?
Nope. If you stay on, I was going to chit chat with you for a minute.
No. Okay. Johnny, you ready? Awesome. Oh, you're on mute.
Yeah.
Oh, good. You ready? I'll tell you, like, this is how we dress for his interview. Sharp.
That's awesome. I noticed that. I was like, that's awesome.
I like scrolling through, looking. I'm like, oh, that's the new person. Oh, that's another new person. That's gonna be cool. I'm excited.
I'm Stacy. I'm one of the instructors.
Hi, Stacy. Nice to meet you.
Nice to meet you.
Any questions for us? Are you excited?
I am. Questions? Not too many. I've been studying. I would say extensively, I guess, on YouTube, getting different perspectives about respiratory care, and I'm ready for it. I know there's ups and then I know there's lows, so I'm mentally prepared for it. I'm just ready for the knowledge. Like I'm like a sponge right now. I've been studying, like I looked at all my classes and just got into detail of each class, studying the heart, the blood that goes, like just so many things. Mechanical ventilation.
He's gonna be the star student. I know it.
Yes, I'm super excited.
I was bugging Carson. I asked her 3 times. I was like, when can I get my textbooks? When can I get my textbooks?
Yeah. Well, I'll tell you what. If you want to, like, you can always come up. Like, we have extra textbooks that are sitting in the office. And if you want a book, you can just come up and I'll meet you up there and we'll grab you one. You can pick through the rack whatever you want.
Please, can you send the address where I can go? I would definitely.
Yeah, it's the main campus, 7475 Deacon. And just send me an email and let me know what works for you. And I'm up actually. Well, Stacy, you'll be up there Monday, right?
Yeah, Monday morning from 8 to 12:30.
Are you busy Monday morning?
No. I'll be free.
Yeah, so if you want to come up Monday morning, just head up to the 5th floor.
Sounds awesome.
I'll be in the lab in the corner, so you'll see us all in there.
Yeah, when you come off the elevators, you make a left, and there's a lab, and then the other students can give you a tour of the lab.
Oh yeah,
Okay,
that'd be great.
awesome.
Yeah.
Awesome.
I just did one for one of the other students in your class. I gave him a tour the other day, and I ended up taking out the glide scope and showing them how the glide scope works and everything, and so intubations and bronchoscopies, and we get more excited about showing you the lab than you get excited seeing the lab. So it's
Awesome.
the stuff that we have now. We've gotten so much stuff in the last few months. It's a lot of stuff still in boxes in the back that we're like, we've got to open up and get, we've just been so busy. We've got all this new stuff and it's so cool. So we're really looking forward to sharing that stuff with you guys, and to get back on campus and to be able to use that stuff every day is going to be amazing.
Hands on.
Yeah. And my butt hurts from sitting in these chairs and Zooms all day. I need to walk around and teach. I can't sit all day. So, it's Susan. Oh, I wonder if I see her on there, but I don't know if she can hear us. But yeah, Johnny, any questions that you have, man, you always feel free to send us an email.
I'm here. Oh no, now I'm gone. Can you see me?
We see.
Can you hear me?
I can hear you. I can't see you, but I hear you.
That's okay. That's okay. I do have a question. If he's going to be there Monday, can I meet him and take a tour as well?
Yeah, as long as it's okay with Stacy. Yeah,
that's fine with me.
Is it okay?
Yeah, of course. So any time between 8 and 12:30, we'll have.
Okay.
And we'll be doing, it's an emergency care lab. So we'll be doing chest compressions and looking at airways and talking about intubations. So it's cool to see too.
Yeah, I just, preparations, just wondering, what preparations do you suggest before, not that we have much time, but before we hit the books?
Yeah, I really think the biggest thing is, just making sure your schedule is set.
Mhm.
That you have the timeline for, because we give you all the classes that you'll need.
Okay.
You can read up on algebra and actually, so I'm taking over the science class just so I can spend time with you guys because they changed the curriculum, so I don't have it. I used to teach communications in first semester. I don't teach it anymore because they got rid of it, and so I'll be teaching science so I can actually hang out with you guys and get to know you a little bit better. I need for you guys to feel comfortable chatting with me and coming to me with with any question. Now I watched something on COVID. Now I'm coughing. But
That's not funny. Sorry.
no, I mean I had COVID in December. It was not funny.
Oh no.
I did not do well with it. But
Oh no.
yeah, so I mean I think it's going to be fun. The program's challenging, but it is it's fun, and you get to meet really cool people. And if you want, there's like we were telling Johnny, there's a bookshelf in the west facing classroom. Any of those books that are on there, you're welcome to take. They're books that students had said they don't want them anymore. They're like, the last model, but you're willing to, you can have whichever ones that you want. And we always just ask that if you take one, bring one back later on when you graduate.
Sure.
So, and give that opportunity to somebody else. So
Justin, as far as getting vaccinated, is that's something I probably have to wait for, or
once you're enrolled into the program, they want to wait until you're a little bit closer to going to clinical rotation.
Okay.
But because you're going to be in the classroom, there's, I guess it's how you look at it, right? I think if you're a student that's in respiratory and you're going to, I would just say I'm a respiratory student.
Okay.
And I need a vaccination. That would keep it so you were able to be in class and not have any problems, right? But sometimes they'll say, hey, but are you going to clinicals in the next 3 months or 2 months? Then I would follow whatever that they're guiding.
Okay.
But if you're on a wait list, like it's the last minute wait list, they're not gonna be able to give that to anybody if they have it sitting out. So I would take that. I would take
Grab it.
For me.
Okay.
I'm gonna take any vaccination I can get.
Right. Right. Absolutely.
But because I think it's the more people that have it, the better, right?
Heck yeah. Well, thank you guys. Yeah, this was great.
I'm glad you got to hop on. So,
yeah, me too.
And it's cool because like Stacy worked with Roman at the hospital. I chatted with him for a long time about transport. So you get to see what capabilities you have as a practitioner down the road, and you can see the passion in his eyes too for what he does. It's pretty cool.
He's an amazing caregiver. We went to school together. I was a class ahead of him, and so he struggled. So I'd tutor him, and we'd sit in a lab. And then once we started working together at St. Anthony's, we'd always bounce ideas off each other to keep it fresh. And
Nice.
He can't care for his patients more than he already did. So
wow,
he's amazing.
That's
awesome to hear. All right. Well, thank you guys so much. And we'll see you soon, hopefully.
Yep. And did you guys get my email yesterday? Like I sent one out last night.
Well, about this? Yeah.
Oh, no, but I sent, yeah, that was for this. Okay. Obviously. Yeah. Because I sent one like a week before. Did you guys get that too?
I got something about scheduling, picking up textbooks.
Yeah. Okay, good. Because I got a message saying that some people didn't get it. So then I sent it. This time I sent it to your PIMA email address and your.
Oh, okay. No, I was the one that emailed you back and said that I was scared shitless, and that was me. That was
okay.
That is a total normal feeling. I started working at university again after. It's 2 years. I've been at 3 years. I've been at PIMA. So, I'd been away from bedside for a while, and I was scared to death going back to bedside.
No.
It's funny because everybody was laughing at me, like, why in the world would you be scared? I'm like, I don't know. Like, it's something new and it's something different, and it's different patterns. Like I said earlier, I don't know where the bathroom is. I don't know where the med rooms are. But now, I've been there for a while and I feel comfortable again, and takes a little bit for your body and your mind to settle into a new process. But once
Yeah,
you
for
do,
sure.
that becomes your new home and your new normal, and then and it just feels great. Like the amount of people that you have in your life that are, like you figure, like at university there's 140 RTs or something like that that are working there. You have a new family, and the nurses that you work with, and leadership structure, and it really changes. It broadens your exposure. It makes it pretty cool. So
I'm
and the money-
excited.
and
I'm
the money's
excited.
nice.
Yeah.
So,
That doesn't hurt. That
Yeah.
doesn't hurt.
all right.
All right. Well, if I don't know if somebody wants to shoot me an email. The other fella said he was gonna. I don't know if he's out or not. I
Oh,
can't
no,
see
Johnny's still here.
anything right now. Okay. Hi,
Okay.
Johnny.
Hi.
Probably be better if we went at the same time, perhaps Monday.
10 a.m. Monday.
10 a.m.
Sounds good.
Does it sound good to everybody?
Yes, that
Sounds
works for
good.
me.
All right. 10 a.m. Monday. Perfect.
All right. Well, you guys have a wonderful day. I got to talk to Stacy about some classroom stuff.
All right. Thank you so much.
All right. You take care.
Nice meeting you, Justin. See you,
Nice to meet
Stacy.
you. Take care.
See you
Bye.
Monday.
See you Monday.
See you Monday.
Bye bye.
You can hit stop recording.
Oh yeah. Thank you.
You're welcome.
I'm glad you said that. Where is it?
Under by share screen. It should say record, stop record.